The discovery of antibiotics revolutionized the field of medicine and has since helped to save millions of lives. However, the introduction into the use of these wonder drugs has been immediately followed by the rapid emergence of resistant bacteria strains. According to Patrick Musicha, a bioinformatics PhD student at the Malawi Liverpool Wellcome Trust, antibiotic resistance occurs when bacteria acquire changes in their DNA, which give them ability to render drugs ineffective. The bacteria survive and continue to multiply, causing more harm through infections that might be difficult to treat.
Bringing out a message that there is a problem, and that's why we're looking at to what extent is a problem. And from our results, it is clear that the usage of antibiotics results in the spread of resistance. So people out there have to know that the more they're using the antibiotics, the more they are helping to drive resistance to the antibiotics. So it's important that we use them in the right manner. Don't just apply antibiotics anywhere, get a prescription from doctors. But apart from that, we understanding the mechanisms of resistance, and to a larger extent, you're looking at the elements within the bacteria makeup that are responsible for the resistance. So if there are issues of developing new drugs and all that stuff, so you're looking at which parts have become ineffective and which new parts can you target in the bacteria that would help you to come up with new drugs.
Musicha added that the overuse of antibiotics is the major driver of the spread of resistant bacteria. He says analysis of bacteria samples from Queen Elizabeth Central Hospital in Blantyre show that bacteria are becoming increasingly resistant to most of the commonly used antibiotics.
We need to protect the drugs and use them wisely. Not just the people in the community but also the health workers, because this is where we get our treatment. And sometimes you just probably give antibiotics without proper procedures. This also happens in the hospitals. And we should know that as we are doing that, we are creating a bigger problem.
Although production of newer antibiotics has slowed down globally, there is some hope in that there is a trend we can reverse by keeping health through simple hygiene and, most importantly, curbing the excessive and unnecessary use of antibiotics, such as for minor infections, which can resolve on their own. Emmanuel Tuwala, MBC News, Blantyre.